Joining us this morning from Simpson Dental, we have Dr. Christen Simpson with us. Thanks so much for joining us. Good morning.
Yes. Good morning.
So let's talk a little bit about, is it true that tooth loss increases risk of death when you're a little older in life?
You know, that is true, and I thought when I saw this article in the American Journal of Preventive Medicine, that title was just so shocking to me, because we always talk about the link of, you know, your oral health to your overall health, but the fact that tooth loss increases the risk of death in older adults really was, you know, a shock. That death word, you know, really kind of catches you by surprise. So this article kind of pointed out the things that can happen once you start to lose teeth, so we'll go through some of those.
Yeah, let's start by talking about dental caries, Dr. Simpson. What is that? I've actually never even heard that word, and how many people actually have them?
Yeah, so dental caries is just dental decay, and actually about 90% of adults 65 and over have had some form of dental decay. And the surprising part of this was that 20% of them are untreated. So that means they have cavities in their mouth that just are hanging out there and spreading to other teeth, because dental cavities are contagious. They spread from tooth to tooth or from person to person. So if they're untreated, they're just going to keep getting worse there.
Yeah, what actually...
And then the gum disease.
What happens when you don't treat the caries?
Yeah, so that decay will just keep spreading in the tooth. It'll spread through the enamel and into the dentin, or spread to the tooth beside of it, so it just keeps getting worse. So it's definitely something you want to treat. And when it comes to gum disease, the gum disease can cause tooth loss as well. So gum disease a lot of times goes unnoticed because it doesn't hurt when you have it. The only time people notice it really is when the teeth become mobile, and by then you've lost a lot of bone, and sometimes the teeth aren't savable. So when you start to lose those teeth, then you get to the difficulty in chewing and eating. And that's where the issue is with older adults, not being able to eat the foods that they need to eat to stay healthy because they don't have the teeth to chew them.
Yeah, and what do you recommend? What happens when they really have a hard time picking out those foods?
Yeah, so, you know, you really want to be able to eat those vegetables and things that are healthier for you, and those take teeth to be able to chew. So, you know, you can get a lot of malnutrition if you're not able to eat those things that have the vitamins that you need to eat to stay healthy. So if you are going to lose a tooth, you need to think of the ways that you're going to replace it. You know, we often hear older patients say, oh, I don't know how much longer I'm going to live, I don't need to replace that tooth. Well, it is important to replace it so that you can chew the foods that you need to eat to stay healthy. So we'll go over some of the different types of tooth replacements, which one option would be a partial. A partial is something that can replace multiple teeth. It's removable. It comes in and out. So that's a good option for tooth replacement. It has a metal framework to give it stability, and then it has the teeth on top of it, so it can replace teeth on both sides of the arch. So that's a good option.
And what about full
if you're
dentures?
Missing all of your teeth. Yeah, so full dentures are for if you're missing all of your teeth. So a lot of times people, an upper denture tends to stay pretty stable, and they can use that for the top teeth. A lower denture tends to be pretty difficult to keep in without having some type of implants to stabilize it. But, I mean, if it comes to at least having something, of course, a denture by itself is better than nothing at all. So it is a great way to replace a whole arch of teeth. So the other option is to use implants.
Okay, now what else can those implants be used for?
So you can use them for even a single tooth. So an implant can be a single tooth replacement that just goes right into where the root of the tooth is, and then you attach a crown right on top of it. So you can use it for single teeth or for a whole arch of teeth. And if you're using it for a whole arch of teeth, more than likely you're going to splint the implants together and put a clip inside of the denture, so the denture just clips right into place over top of those implants and keeps it really stable, so that way you're able to chew better. So that's a great option for those lower dentures that move around.
Yeah, a lot of options there. And Dr. Simpson, explain what a locator implant support prosthesis is.
So using a locator is just a different design with using the implants to have a single attachment on the top of it. So this would be maybe if somebody, these are smaller implants, so if you have a decreased amount of bone, if you've kind of waited a while and that bone has shrunk away, this is an option to still be able to have implants in those areas. So dentistry's come a long way, so many advances to be able to replace teeth and give people back the things that they need to be able to eat those foods to stay healthy.
Dr. Simpson, a lot of really good information this morning. Thanks so much for joining us here on Studio 3.
Well, thanks for having me.